Welcome to Joburg Fertility Centre. At Joburg Fertility Centre, we are dedicated to turning dreams of parenthood into reality. As the leaders in advanced reproductive care, we provide a cutting-edge fertility treatment tailored to each patient's journey. My name is Dr. J.E. Muloi, and I'm the fertility specialist. Today, I will be discussing an important topic that brings home to many women who previously underwent sterilization. The question that many parents ask is whether it is possible to fall pregnant after their tubes were tied. The answer is yes. And the procedure that make this possible is called laparoscopic tubal ligation reversal. In this video, I will take you through a detailed explanation of what tubal ligation is, who qualified for the procedure, and how the surgery is performed, what success rate to expect, and the possible risks. Let us begin by understanding what tubal ligation is. Tubal ligation is a permanent method of contraception. During this procedure, the fallopian tube are either cut, tied, clipped, or cauterized in order to prevent pregnancy. The fallopian tubes are very important in reproduction because they carry the egg from the ovary to the uterus. Fertilization normally takes place inside the fallopian tubes when the sperm meet the eggs. If the tubes are blocked or interrupted, the sperm cannot reach the egg and the pregnancy cannot occur naturally. However, circumstances in life often change. Some women later decide that they would like to have children again. This may be due to remarriage, the loss of the child, improved life circumstances, or simply a change in personal choice. For such patients, tubal reversal offers an opportunity to restore fertility. Tubal reversals, also known as tubal ligation, is a surgical procedure that reconnects separated or blocked segment of the fallopian tube. The goals of this surgery is to restore the natural pathway so that the eggs and the sperm can meet again, allowing fertilization to occur and enabling natural pregnancy. It is important to understand that not every patient is a suitable candidate for this procedure. Proper assessment is essential before making a decision. Generally, women who are young than 40 years of age tend to have better outcome. The ovarian reserve must also be adequate, which we assess using blood tests like AMH. In addition, there must be sufficient healthy fallopian tubes remaining after the initial sterilization. The condition of pelvis is also important, as severe endometriosis or extensive scar tissue can reduce the chances of success. Furthermore, the partner's sperm quality must be also analyzed. Before proceeding with surgery, we usually perform a full fertility evaluation. This includes blood tests, pelvic scan, and semen analysis. In some cases, additional procedures may be required to assess the pelvic anatomy. The tubal reversal procedure itself is performed using a laparoscopy, which is a minimal invasive surgical technique. The patient is placed under general anesthesia and a small incision are made in the abdomen. A camera is inserted to allow visualization of the internal organ. The surgeon carefully identify the blocked end of the fallopian tubes and remove any scar tissue. The healthy end of the tubes are then meticulously reconnected using very fine suture under magnification. This type is extremely dedicated, requires a high level of surgical expertise to ensure proper alignment and functioning of the tube. The procedure typically takes between 1 and 3 hours, depending on the complexity of the case. Recovery after the procedure is generally quick because the surgery is minimal invasive. Most patients experience only mild discomfort. Patients are usually discharged on the same day of the procedure. Normal activities can typically be assumed within 1 or 2 weeks. We advise avoid heavy physical activity during the recovery period and attending follow-up appointment to monitor healing. The success rate of the tubal reversal depends on several factors. Number one, the age, and number two, which is also important, is the MH. In general, pregnancy rate range between 40% and up to 80%. High success rate are seen in young patients with good ovarian reserve and adequate tubular length. Most pregnancy occur within 6 weeks to 12 weeks after the procedure. As with any surgical procedure, there are risks involved. These include infection, bleeding, and injury to surrounding organs. Although the complications are uncommon, one important risk to be aware it is ectopic pregnancy, where the pregnancy occurs in the fallopian tube instead of it happening in the uterus. This condition can be very serious and require early diagnosis and treatment. A common question that patients ask is whether they should undergo tubal reversal or proceed directly to in vitro fertilization. Tubal reversals allow for natural conception and the possibility of multiple pregnancy without repeat procedure. On the other hand, in vitro fertilization offer a quick route to pregnancy and it's often more suitable for older patients or those that had additional fertility challenges. The choice between this option should be individualized based on the patient age, ovarian reserve, tubal condition, and even sperm quality. In conclusion, tubal ligation does not necessarily mean the end of your fertility journey. With proper evaluation and expert surgical management, many women are able to conceive again naturally. The key is to assess each case carefully and choose the most appropriate treatment option. If you consider tubal reversal or you'd like to explore your fertility options, we encourage you to visit Joburg Fertility Centre for a comprehensive consultation. We are committed to supporting you throughout your journey to parenthood. Thank you very much for watching. Please remember to like, share, and subscribe to our channel for more educational content on fertility and reproductive health care. Please follow us as we release every week a new video which can be very educational. Thank you.